When we dive into the actual arthrokinematics or the spine biomechanics, we can look at the facets, and I think this is a very important thing for us to understand as Pilates teachers, is that the angle of the facets determine the bias of the movement in those lumbar segments, in those thoracic segments and cervical segments. Now in the lumbar spine, I mentioned that the facets are actually in a vertical orientation, right, and sagittal. So they're at 90 degrees in a sagittal movement. So if that facet meaning face of the back, right, they're the back part of the tripod of the vertebra, as they slide forward and back in their articulation, that's going to represent spine articulation in flexion and extension in that plane, right, the sagittal plane, and that's going to be the easiest direction of movement of that facet. Now imagine if I wanted to rotate and I'm pushing back and forth, there's not a lot of rotation available in the lumbar facets. And lastly, if I do just one side, I can actually create side bending in my spine by a lateral flexion by unilaterally gliding up in that sagittal plane. I just want to reiterate that the lumbar spine primary responsibility is to bear weight, and it has a primary motion direction of flexion and extension because of the angle of the facets. Now as we move up into the thoracic spine, remember I said that we determine the thoracic spine by its attachments to ribs. Well, it also has some unique properties because at T11, the spine actually changes its orientation. The facet goes from a sagittal plane facet to a coronal plane facet. And not only coronal, but it also tilts down to about 65 degrees. Now I want you just to imagine for a second, we will go back to the lumbar spine. We said that they were vertical and sagittal, so they moved in this direction and flexion extension. If I have them in coronal plane and 65 degrees and they slide on top of each other, I'm still going to have flexion extension. The difference is if I move unilaterally on one side, I now have introduced rotation. If I do unilateral side bending, I'm going to get blocked because I'm going to hit the lower facet and the rib, and it's going to minimize the amount of lateral flexion. So let's just reiterate. Thoracic spine has coronal facets at 65 degrees. In the lower thoracic, its primary direction of movement is going to be flexion extension, then rotation, and then side bending. As we move up into the upper thoracic, T1 to T7, we're going to have our primary motion direction is going to be rotation, then flexion extension, and then side bending. Now you might ask yourself, why would the upper thoracic be different than the lower thoracic? Well, if you look at the anatomy and realize that the scapula actually rests on T1 through T7 and are part of the actual movement or organization of the upper extremities that gives us dexterity, it would make sense that the upper thoracic's primary motion direction would be rotation to give us greater dexterity and suppleness in the use of our upper extremities in our daily lives, where the lower thoracic still is more in flexion and extension than rotation. So it's just understanding where the function of our body comes from. We're actually designed to function well. Now as we move up into the cervical spine is also in the coronal plane, but we lose even more degrees and we come down to about 45 degrees between C3 and C7. So you can imagine again greater freedom in rotation and forward bending and back bending or extension, but we also don't have ribs on the cervical spine, so there is some lateral flexion in the cervical spine. Again, it would be in the order of rotation, flexion, extension, and side bending. And the reason why rotation is so important is because our head needs to have ample movement to be able to see around us for safety and security. Now the very top two vertebrae of the cervical spine is the C1 and C2 vertebrae. Now these two vertebrae are really important, okay, because 50% of the motion of our head comes from these two vertebrae. So we have it between the head and C1, we have flexion extension and lateral bending. And what I want you to imagine is like a bowl, right, with a ball inside the bowl. And that angle of the facets or the orientation of that C1 is almost flat or horizontal to the ground. So the head moves in it like a ball moving in a slippery bowl. It can move forward and back, which would be flexion extension, and side to side, which would be lateral flexion. Now the next level down between C1 and C2, there's a little bone that comes up that is called the dens. And C1 wraps around it, and they also are horizontally oriented. Remember, we've gone from being sagittal, coronal, flattening out, and eventually get up to C1, C2, and it's horizontal. And so that is where 50% of the rotation comes from of our head. So to reiterate, cervical spine, primary purpose is to support and move the head. It has coronal facets. They are about 45 degrees between C2 inferior down to T7. And then C1 and C2 are horizontal and are responsible for 50% of the movement of the head.